You're watching and listening to VABC Association News, corporately located in Arizona and trademarked internationally.
A central line is a specialized catheter placed into a large vein, often in the neck, chest, or groin. It's a lifeline for critically ill patients, delivering essential medications and nutrition directly into the bloodstream. But this access point also creates a direct pathway for dangerous germs, leading to a serious infection called CLABSI, also known as central line-associated bloodstream infection. When bacteria travel along the line and enter the bloodstream, the result can be sepsis, longer hospital or long-term acute healthcare stays, and even death. Preventing CLABSI must be a top priority for hospitals and long-term care facilities, and a key measure of patient safety. Hospitals and long-term acute care facilities are required to track and report CLABSI rates to agencies like the CDC, and these numbers are often made public. This transparency is meant to empower patients and push hospitals and long-term acute care facilities to improve infection control. Accurate reporting is essential. Patients and families trust these numbers when choosing where to receive care. But what happens when the pressure to look good on paper distorts the data? The integrity of these numbers is the foundation of patient safety. If the data is manipulated, the entire system is at risk. Public reporting of CLABSI rates puts hospitals and long-term acute care facilities under intense scrutiny. High infection numbers can damage reputations and drive patients elsewhere. Financial penalties from Medicare and Medicaid add even more pressure. Millions of dollars can be at stake. The result? Hospitals and long-term care facilities may focus more on protecting their numbers than on preventing infections. Self-reporting relies on institutional honesty, but the temptation to game the system is real. Some hospitals and long-term acute care facilities may reclassify infections or interpret definitions in their favor to avoid penalties. The goal shifts from patient safety to avoiding a bad report. This undermines the purpose of tracking CLABSI and hides real risks from patients. When numbers matter more than care, the system fails those it's meant to protect. Manipulated data gives a false sense of security. The real danger is what goes unreported. The drive to keep CLABSI rates low can lead to risky decisions. Doctors may hesitate to order blood cultures for patients with central lines, fearing a positive result will count against the hospital and long-term acute care facility. This delay can let serious infections go untreated. Hospitals and long-term acute care facilities might remove central lines prematurely, forcing patients onto less effective or more painful alternatives. Sometimes a patient needs a new line days later, increasing their risk. Infections may be labeled as something else, like pneumonia, to keep CLABSI numbers down. These workarounds are not rare. They're reported by healthcare workers across the country. The focus on numbers silences concerns from patients, families, and staff. Real safety issues are hidden, not fixed. The system rewards appearances, not actual improvement. The core problem is asking hospitals to police themselves when so much is at stake. Financial and reputational pressures can lead to data manipulation, not better care. Leadership may celebrate low infection rates without questioning how they're achieved. This can demoralize staff and create a culture where safety concerns are ignored. Patients are put at risk when infection data can't be trusted. Healthcare workers face ethical dilemmas, torn between best practices and administrative demands. The quality of care suffers, and trust in the system erodes. We need independent audits, independent agencies, stronger whistleblower protections, and leaders who put patients first. Honest reporting should be a tool for learning, not punishment. Only with real accountability can we rebuild trust and make hospitals and long-term acute care facilities safer. Patient safety must always come together with integrity-driven numbers. At the VABC Association, together with the VABC Training Center, we are working on solutions every day to help educate the public and immediately raise healthcare CLABSI reporting metric standards, so we can begin to clearly track with absolute accuracy. We live in a day and age where solutions are abundant if we seek out the answers, but in order for that to be accomplished, we have to acknowledge the root cause and not mask it. By identifying root cause, we can come together as one body in knowledge and support to create empowering, productive, and outstanding ways to raise the level of care by raising the level of leadership, standards, and systems. If you would like to learn more about the VABC Association and the VABC Training Center and become part of our force for good and movement for higher standards in vascular access education, training and certification, protecting healthcare whistleblowers, truthful patient education and safety and copious solutions, go to www.va-bcassociation.org. Again, that is www.va-bcassociation.org. And remember, your voice matters, your knowledge matters, your contribution to patient service and humanity matters. And by all of us listening, putting solutions to work, and going beyond our comfort zone, we can astonish the world with elevated care that uplifts, restores, and rebuilds our amazing future. VABC is corporately located in Arizona and is an international registered trademark covering Australia, Canada, China, European Union, United Kingdom, and the beautiful United States of America.